The interesting part about concussions is that the research is very quickly advancing. So it's probably been within the last 10 to 12 years that we've really started to get guidelines. There's anywhere between 1.6 and 3.8 million concussions that occur every year. A concussion is a process that occurs as a result of a blow to the head. Primarily with concussions, we see a lot of headaches. Sometimes you'll hear them complain of visual symptoms. They may be sensitive to light, sensitive to sound. And the biggest thing that I work with is individuals that have trouble with their balance or sensitivity to motion. We see a lot of these symptoms pop up, but it can take a little while for them to appear, anywhere from a number of hours up to a couple of days. And the concussion management program is comprised of two parts, depending on where you are at in the process. For younger athletes, middle, high school, even early college age, we try to encourage them to do a preseason baseline. It's something that's recommended by the CDC as well as the NCAA. So those patients would be able to self-refer. They could be brought in. There's one fee for service. They would see me one time, and they come in and we do an interview and some baseline testing. And for certain individuals, if they've already had head injuries or if there's something else in their history that makes them a little different from somebody else, there's an advantage to knowing what they were prior to the season so that you know you don't send them back to sport too early. We don't want to risk them having another injury. So a lot of the other patients that I treat are ones that have been referred either from primary care, or I work very closely with our neurosciences department. So I provide the rehabilitation for patients that may have balance or dizziness or motion sensitivity issues. And then the neurosciences department looks into their neurocognitive testing. But those individuals that may have had work-related injuries, they may have been in motor vehicle accidents, they might be coming from primary care or occupational health, but they'll be referred to physical therapy with the focus of looking at their head injury or coming to the concussion management program for that reason. The advantage of having this team is not only can we help sometimes boost the progress and push them back to sport faster, but we also have a way of collaborating with them and saying, yes, we think that person's ready, versus no, we still think that there's other issues that we need to help with. And we don't want anybody to end up with any kind of long-term health issues. Having that medical team in place and having somebody that you can turn to takes the guesswork out of it.